All right, welcome to In Chrysalis. I am Becky, and today I am joined by a special guest who I have been following on YouTube for quite some time on Kaki's RNY journey. I'll be linking her channel in the show notes here today. But would you please introduce yourself to our listeners?
Yes, absolutely. Thank you for having me on, Becky. My name is Kenda. I go by Kaki. That is what my family has always called me. So when I decided to do a YouTube channel, I kind of adopted that name. First off, I'm a nurse practitioner in a small private practice. I see all ages, all ranges of folks. But more importantly, to what we're talking about today, I am a bariatric surgery patient. I had gastric bypass in 2022, and at this point, am exactly where I want to be. I have lost about 145 pounds and have been maintaining that for a couple of years now. As a healthcare provider as well as a patient, I feel like that kind of gives me some insight into what it takes to get through this process and be successful and honestly how I can help my patients to achieve better health as well.
Oh, absolutely. Well, congratulations on that tremendous
Thank you.
success. And I'm 120 down from what was my high weight. So
Awesome.
yeah, I think there's just something about when you have lived the struggle,
Absolutely.
the lens through which you view everything it changes. It changes you.
Absolutely. Yes.
Absolutely. So, in at least one of your videos that I can recall, you speak about how weight has been an issue for you since you were a child. So, can you speak briefly to that experience? Because that is something I also know very intimately.
Yes. Yes, I remember even in kindergarten, I was the heavier of my classmates. And as elementary school progressed, that just got a little bit worse. I think I went on my very first diet when I was about 7 years old. My mother, who also struggled with her weight, got special permission to check me out of school at lunch. We lived close to the school and we would go home at lunch and she would prepare a lunch from the Scarsdale medical diet. Now that's really going back. I'm dating myself. But typically that was something like tuna and cottage cheese or a hamburger patty and cottage cheese. So I very much grew up with the mindset of there was something about me that needed to be changed and seeing my mother also struggle with that and it becomes who you are. It truly influences
Totally.
everything. So as I went through my school years, when I was in middle school, I successfully lost probably 30 pounds, which put me at a quote unquote normal weight. And then throughout high school, I fought to stay that normal weight. And then eventually life caught up after I graduated from high school. The pounds started packing on. And over the course of, I don't mind saying I'm 53, over the course of my lifetime, I have probably lost and gained 100 pounds several times. So
Mhm.
it is very much something that has always been present in my life.
Okay. So yeah, we're very much peers. I'm 52. So
Okay.
absolutely. So yeah, we're Gen X.
Yes.
Okay, so yeah, I can also, remember, being kindergarten, first grade, and, just having it pointed out to me pretty regularly that
hmm
I was definitely the biggest girl in class, and, that there was something about me that was wrong.
hmm
And, it didn't matter what my positive attributes were or what my really, amazing skills were. This was always first and foremost my identity.
Yes. Yes.
Yeah, and that was challenging. So, um, So as a nurse practitioner, I'm really interested in this. So in what ways, if any, do you believe your weight was an issue for you as far as your career as an NP?
Well, I don't feel like it was a barrier.
Okay.
Thankfully, in nursing is very much a female, still to this day, driven profession.
Hmm.
And I was among peers, whether they truly had a weight problem or not. Most of my coworkers, peers, when even in my educational programs, struggled with their weight. So even though I think in some ways we as women judge other women more harshly, in other ways, I think that it was more of an accepting space. I did not have to worry about pretty girl discrimination. I don't know any other way to say that, of where I was working with a lot of men who might have dismissed me because of that. I was very much, thankfully, in on common ground with most of my peers. So I don't feel like it was a barrier at all.
Okay. And that is really, really great to hear. I'm glad to hear that. I think also for me, going into higher education where people tend to be, pretty compassionate, pretty understanding. I
Hmm.
don't feel as if, it has been a barrier for me. I would say sometimes for me and definitely for my own like imposter syndrome and things like that. There have
Sure.
definitely been times when it's been in the room, but I don't feel as if it was a barrier
Right.
for
Right.
me. Yeah, yeah. So, what ultimately led you to pursue gastric bypass surgery? And I think also, right now there's so much talk just everywhere you look about, should you try a GLP-1? Should you go for the surgery? And for me, having lived both experiences, there are definite pros and cons to both. So,
Absolutely.
yeah, so what was it that ultimately led you to choose surgery?
Well, a couple of things. First off, the thing that really led me to want to be healthier, to lose weight, which led me to it wasn't so much the weight loss as the way that my weight was limiting me. I love to travel. That is my passion.
Mine
And
too.
yes, and I got to a point where I am fortunate enough to I take do my best to take two international trips a year.
It's great.
And I got to the point where I felt like my weight was keeping me from enjoying these wonderful places that I had read about in books and dreamed about. And I was not fully able to enjoy them. So went back to what can I do? And from a background of someone who had struggled with their weight their whole life, and like I said, who had lost and gained back the same 100 pounds, I felt like it was something that I needed help with. Over the course of my career, I had seen and referred a lot of patients to bariatric surgery. I had seen patients be wildly successful, and I had also seen patients with weight reoccurrence. So I felt like that gave me the insight into the permanent changes that I needed to make. At that point, in tw- when I first started really considering bariatric surgery was a couple of years before I actually had it. I did try a GLP-1. I am a non-responder.
Okay.
About 15 to 20% of the population are non-responders. I
Right.
could not tell I had taken anything. My appetite was not suppressed. I did not have any change in digestion of food. I didn't feel fuller longer, just absolutely nothing. So I did that, gave that a really good go. It didn't help. And realistically, even if, from my professional experience, even if it had helped, I feel like I probably would have not gotten where I wanted to be. with just a GLP-1. So I probably would have gone on to have bariatric surgery. But that's kind of what led me ultimately to that choice was wanting to, I was seeing more medication added. I started, the day that I had surgery, I was on three blood pressure medicines, a cholesterol medicine, a medicine for joint pain from literally the extra person I was carrying around. And I didn't want that for myself. I wanted to be able to fully participate in life and all of the wonderful opportunities that I had.
Yeah, Al, I can so relate to so much of that. So, yeah, when I had my Roux-en-Y in 2009, which I consider to be the best decision of my life.
Mhm.
My husband likes to think he was the best decision of my life. He's in the top three, but that says
Right.
it was the best decision of my life. Don't tell him that. He's in the basement right now. He'll probably see this later. No, seriously, when I had it, and then I lost a significant amount of weight right away, and I didn't go as far as I could have with that, and there are a lot of reasons for that, and I was one too that I experienced a lot of fear once I
Mm,
got to a certain place, and I am I'm very upfront about that, but then um, it's still just when I think about had I not done it because when I was
absolutely.
yeah when I was in my 30s and I did it, I was starting to have some of those extra problems, and I was not able to do all the things that I wanted, and I love to travel also, and been to 27 countries, and it's who I am,
Hmm.
and having that limitation that it didn't need to be, and I never saw my gastric bypass as a last resort. And I think a lot of people think of it as a last resort. What my thinking was is I want a powerful tool that is going to have staying power. And what is going to be
Absolutely.
the most efficient method? And in 2009, that was it.
Absolutely. Yes. And that last resort mindset, I run into that. That's one of my biggest challenges with patients, with
Oh, I
talking
bet.
to them
Yeah.
about bariatric surgery. I cannot tell you how many patients I have had say to me, I'm too young to do this.
Mhm.
And we're not talking 18-year-olds. We're talking people approaching middle age.
Mhm.
I want to save that as the last resort. I want to try everything else. And it's sad to me because I see what an enormous difference this surgery, this tool has made in my life. And my biggest regret is not doing it when I was in my 30s. So I wish that I could wave my magic wand and give these patients the insight into, and that was one of the reasons I started my channel as well, for myself more than anything to document. But I wanted to be upfront with what life is like after surgery. And of course, I didn't know. I did my first video the week before surgery. I didn't know if it was going to be a good life or a bad life. I had a feeling it was going to be good based on what I had seen, but there was always that very real chance that I could be the one with complications or the one in whatever very small percentage that it doesn't work for. But I wanted to give people some knowledge and some clarity of that this is not your last resort. This is a door that you are opening for the rest of your life. And I wish that people would understand that.
Oh, absolutely. I think, with metabolic syndrome,
Hmm.
this is something you're going to struggle with for your entire life. If this is something you have, you are constantly going to be battling against your weight, against the regain, and all of the other comorbidities that go along with
Hmm.
it. And having as many tools as possible in your tool shed, it's just going to make the process better. And
Absolutely.
yeah, oh, absolutely. So, um, tell me a little bit about your surgical experience, like the pre-op
Mhm.
and everything post-op.
Sure. I was very fortunate that my surgery was covered by my insurance. I
Mm,
know many people that is not the case, but mine was. And I had a relatively problem-free pre-op period, getting approval. I went in, my insurance, and everyone's insurance is different. I see everything from requiring a 6-month period of visits to, like myself, the only thing that I had to do to get my surgery covered was the doctor had to send a pre-authorization. I had to have a meeting with him. I had to attend 3 support groups. I had to have a psychological evaluation and have a meeting with a dietitian. There was no wait, there was nothing. I remember I was in the car driving to the airport to go to Kenya, and my phone rang, and it was the bariatric coordinator telling me, "We've got you approved. When do you want to do this?"
oh,
And
wow.
I've said, "Well, I'm leaving for Kenya and I'll be gone 2 weeks. And I know I have to have a 2 week liquid diet. So I'm fine with starting my liquid diet as soon as I get back." And she said, "Okay, let's get you scheduled." And I was scheduled and went on that trip. And I remember tell and I know you have discussed this on your channel, sharing your medical information. I was so excited about what was coming. I remember that was my main topic of conversation on that trip with the ladies
Mhm.
was, when I get back, I'm going to do this. And they were so supportive.
Good.
And I had so many, there were, I think, 10 ladies on this trip. And we had a group chat on WhatsApp and we were shooting each other messages. How are you? Send me pictures. How are you doing? Are you having any problems? And it was such a wonderful environment
That's
to
great.
be in. But my pre-op was very smooth. I had no problems. The 2 week, my surgical team, as I said, required a 2 week liquid diet, was not the horrible experience that I was afraid it was going to be. And I tell my patients, don't let that fear of that. That's like boot camp. Once you get through it, you've got the rest of your career. So don't let
Yes.
whatever you have to do, whether it's hoops through insurance or that pre-op diet or going to get your psych eval, whatever it is, don't let that deter you from what you really need to do.
Hmm. Hmm. Oh, and that's wonderful. I had not told very many people when I did mine, and uh, yeah, and you mentioned the video that I have there. Yeah, I tend to hold my cards pretty close to
Sure.
my vest initially. Once I am comfortable with something, I am willing to share it. But I think also like when you offer the information, you're
Hmm.
inviting the feedback.
Absolutely. You're
And
opening the door.
when you are not certain of what kind of feedback you're going to be getting, you've got to be really selective. So I've got my inner circle,
Absolutely.
and my battle-tested crew that I know I can trust, and they're going to be supportive of me. And sadly, I think there's so many people who don't have that. Whether they choose,
Absolutely.
whether they choose surgery or GLP-1 or some other,
Hmm.
method or some other tool, and they just don't have that support. And
Yes.
that's really upsetting to me.
Yes, absolutely.
Yes, yes. So I'm curious then, because there is so much weight stigma in medicine. I mean, that is
Hmm.
documented in peer-reviewed journals,
Absolutely.
right? There is so much stigma. So I'm curious, what do you wish other clinicians who haven't had this personal struggle, what do you wish they could understand about their patients with weight challenges?
I think it's very individual, even to the patient. Looking back, m- as someone who was morbidly obese my whole life, I wish that I had been offered this surgery earlier in my journey. I wish that someone had said to me the things like I just said about this being a door to the rest of your life. But I know other people who get very bristly when you bring it up, when they feel personally attacked. So that's a hard thing. I think
Yeah,
that I would wish that my colleagues would understand that obesity is truly a disease.
absolutely.
There is a choice in behavior, without a doubt, but I truly believe that we have all known someone who can eat 10,000 calories a day and never gain weight.
Oh, for sure. Yep.
And then we have either been or know someone who can struggle and do everything right by the textbook and not have lasting success. So I feel like that if I could make my colleagues understand that the pat move more eat less advice is not it's not the answer,
Yeah.
and to be more looking at even me as an obese person, I am more now that I am not as obese, and I will always consider myself an obese person, even though my
Absolutely. Me
BMI
too.
is,
Yep.
is in the normal range, my disease is in remission and it
Mhm.
can come back. And I always remember that. But I notice things now that I don't struggle as much that I didn't before.
Mhm.
I guess I just assumed that this was the way the world was. For example, uh, things like exam gowns that don't close all the way in someone obese, things like chairs. I struggled so much in offices, fitting in chairs, dreading going in and sitting in chairs. Now I have bariatric chairs in each exam room and in my waiting room. I didn't do that when I was heavy.
Mhm.
So it's funny how things like that have changed my perspective. But
Yeah.
those are the things that I really wish that other providers could. It's like I said, it's very much a balancing act. I wish
Right.
someone had said to me, had offered me these choices and had educated me more earlier, but I may not have been ready to hear it. But
Mhm.
I do bring up with pretty much, and that kind of leads into probably another question, but I do bring up pretty much with every patient at least once a year the possibilities of how I can help them or medicine can help them to reach their goals, if those are their goals.
hmm Oh, I think that's wonderful that you bring it up in that way. I think, my experience, and I've been iatrophobic seriously my entire adult life. And, I've had, a couple of experiences along the way that I won't go into right now that have absolutely, acted as, accelerants
Sure.
to that particular fear. And, I think now when I go into like my doctor's office, I think there's 10 MDs, and then we've got our nurse practitioners and our PAs. So it's a big office. In the waiting room, there are the standard size chairs, there are the bigger chairs. There are also the chairs that are a little higher up for,
Yeah,
yes. So I mean there is a
that's
variety.
wonderful.
Yeah, a real nice variety of seating options. And then there's the area for kids too. And I love seeing that inclusivity. And I think one of the things that I'm also noticing too is that this next generation of practitioners, they tend to be, at least in my experience, a little more understanding
Hmm.
about weight and viewing obesity as a disease as opposed to a character flaw.
Hmm.
And so I'm definitely seeing that, and I'm happy that I am seeing that shift in perspective. And I hope that that continues to be the case.
Yes. I find that very much to be true as well. I think that across all uh, flavors, shades of variation in the human experience, I think that the generation that is being educated now or who have recently been educated are reaping the rewards of the acceptance that many of us fought for. And I feel like that it's funny. I have in my office, I'm the only healthcare provider, and then I have nurses and receptionists, but I am the only person who has ever struggled with their weight in my office.
Yeah,
And most of, well, all of my staff are in their 20s. So we're talking considerably young, could be my daughters.
right.
And one of the ladies in my office said something, one of my patients commented to me about how nice I looked. And oh, you look so nice. You look like you feel so good. And I took that positively.
Yeah.
After they left, my nurse said to me, that offended me. And I said, offended? Did they say something to you? And she said, no, you don't comment on people's bodies. And I said, well, they really weren't commenting on my body. It's not like they narrowed down one body part. She said, oh, but they were. I took it that they were saying, you look good in your body that's different. And she said, I find that offensive. We don't do that. And I thought, wow, I'm not easily offended, but I was thankful that that is the perspective of that age group.
Okay, so yes, I'm glad you brought that up because I see that in my college students. So I
Mhm.
work predominantly with the 18 to 23 crowd,
Right?
with undergraduates. And yes, there's nowhere near the commenting on people's appearance
Yes.
that we grew up with. And
Hmm.
there's a part of my brain that's like, I don't know how you could be like a Gen X or millennial woman and not have some type of PTSD from diet
Yes.
culture, just from we were inundated with it
Hmm.
every single day and commenting on each other. And I know
Hmm.
I go to reformer Pilates twice a week. It's part of my routine, and I am absolutely obsessed with it. I'd go 6 times a week if I could.
Yes.
But it is a fully inclusive, open and welcoming
Absolutely.
studio. And as I've been going through this, I could tell like, people wanting to ask me
Hmm.
questions. And what I found was, if I said something like, "Yeah, I'm feeling really good these days," and then they're like, "Can I ask you?" And like, yes, you
Hmm.
can. But I found they wouldn't bring it up first, that I
Right.
had to kind of, crack the door a little bit so they felt
Hmm.
like they could bring it up.
Right. Right. Well, in my practice, I have a large population of people who are not from the United States originally.
Okay.
And it's funny how culturally it's viewed differently, commenting on other people's
Yes.
bodies.
Very true. Yep.
It is so funny. Especially Asian people tend to be much more, they don't, my perception is they don't see your weight as a negative thing. It's just like saying you have red hair or you have brown hair. And so commenting on weight to them is not them doing anything wrong. And I remember I was at a store one time, and one of my patients, who is originally from the Philippines, was there with her granddaughter,
Mhm.
who was born and raised in the United States. And she said, oh, this is Kenda. She used to be fat, but she's not anymore." And the granddaughter was mortified,
Oh, I bet she was.
absolutely mortified. She said,
Yeah.
"Grandma, you can't say those things to people." And my patient said, "Well, she knows she was fat."
Oh my goodness. Oh yeah,
And I thought,
I could see
such
the granddaughter just
uh,
wanting to crawl into a hole
she
after
was
that.
mortified. But,
Yeah.
it was, it really tickled me because the grandmother, my patient, she did not, there was no insult at all to it. It was just an observation. It was just like saying, I might say to somebody, "Oh, when we went to high school together, she had hair down to her waist." It's not,
Right.
there's no shame. So I just thought that cultural perspective is funny too.
Oh, oh, absolutely. I'm glad you brought that up. So I've got just one more, a final question for you today. And
Yeah.
then what would you tell that past incarnation of yourself about your life now? What does she need to know?
Oh, goodness. I would tell myself, don't wait. Don't let fear stop you from experiencing life. And that's truly what it was before. It was fear.
Oh,
Don't
sure.
let don't let fear hold you back. There is a wonderful new healthier life on the other side of this, and life after bariatric surgery is much better than before for me. I'm a foodie. That was one of my big fears, was, am I going to be able to still enjoy and experience food? Absolutely.
Of course.
I can, and I can fly without a seatbelt extender. I can walk without struggling and looking for the next place to sit down. So I would tell myself, don't wait. Don't
Yeah.
wait. Do it. Make the most of it and enjoy the ride.
Oh, well, I couldn't have said it any better myself. Just don't wait. Don't yeah, just don't put it off. This is
Absolutely.
absolutely a decision that you need to make for you, regardless of what tool you choose to implement.
Yes,
You just got to start somewhere. So start.
absolutely. Absolutely.
Absolutely. Oh, Kenda, thank you so much for joining me today. And like I said, I will add your link to your YouTube channel
Thank
in
you.
the show notes. And everyone, please subscribe to her channel. And I look forward to seeing everybody very soon. Thank you so much for joining us.
Thank you for having me.
Absolutely.